Hey, welcome to Meet Me at the Spot, where pleasure meets education. This is the space where we get real about sex, relationships, and everything in between. I'm your host, Holly Eckelberger, and I'm a longtime sexual health educator, activist, and content creator. I will be your guide through conversations that blend curiosity, pleasure, and truth. Together with some amazing guests, we'll break down stigma, celebrate bodies, and learn how to embrace sexual health with confidence and joy. So get comfy because it's time for the show to get started. Hello, everyone, and welcome back to another episode of Meet Me at the Spot, where pleasure meets education. I'm your host, Holly, and today's episode is a Black History Month special. Now, this is not a history lesson frozen in the past, and we're not going to be doing dates and memorization. Now, this episode is about how we got here and the ideas that still shape our bodies, choices, pleasure, and care today. It's about honoring the Black people, especially Black women, who built the frameworks so many of us are working within right now, whether we always realize it or not. When we talk about sexual and reproductive health in the United States, you're talking about Black history, Black innovation, Black communities solving problems long before systems decided to care. And we're talking about joy because survival was never meant to be the finish line. Reproductive justice was created by Black women who noticed that movements who were claiming to speak for everyone kept leaving the most impacted people out. Now, before we jump into this episode, I want to recognize that I am a white woman doing this work within a framework created by Black women. And I'm not saying that as some kind of disclaimer or a performance, but really as a grounding. This work asks us to know where ideas come from, who shaped them, and what responsibility we all carry when we use them. I launched this podcast 3 years ago, intentionally in February, which is Black History Month in the United States, to honor the Black women who created reproductive justice. And this episode is part of that ongoing practice of learning, crediting, and staying accountable. Today's episode is about gratitude and clarity. Legality has never automatically meant access, and access without dignity has never meant justice. In this episode, I'm going to highlight some people, movements, and ideas that shaped reproductive justice, and knowing that this is not a complete list because no episode could be. So as you listen, I'd love to hear from you who you would add. DM me, tag me, and tell me who shaped your understanding. Let's get into it. Let's start with Dr. Rebecca Lee Crumpler, which is not the beginning of medicine, but really at the beginning of asking who medicine was actually built to care about. Dr. Crumpler was the first Black woman physician in the United States. She practiced in the 1800s during Reconstruction, which was a time when racism in healthcare wasn't subtle, it was policy. White physicians refused to respect her credentials. Patients were steered away from her because of her race and gender. Care for newly freed Black communities was framed as charity and not a right. And yet, she still showed up. She didn't just practice medicine. She wrote a book of medical discourses, which was one of the earliest medical texts focused on women and children, centering the needs of formerly enslaved people. She treated medicine as service, not status. And she practiced relationship-based care long before that phrase showed up in training manuals. She shared knowledge instead of gatekeeping it. Choosing to care for mothers, babies, and families in the aftermath of generational violence is an act of love. And her work isn't history, it's happening now. Black women today are still less likely to be believed when they describe pain, and more likely to die from pregnancy-related causes, and are still navigating systems that treat them as problems instead of people. Every conversation about respectful maternity care, culturally responsive providers, and Black-led health clinics echoes Dr. Crumpler's motto. She showed us that care can be skilled and tender, clinical and compassionate, and effective without being cold. Now, before hospitals, OBGYNs, and insurance billing codes, there were Black midwives, granny midwives. These were community birth workers who held generations of Black births with deep knowledge of bodies, herbs, intuition, and care that didn't stop once the baby arrived. Birth was supported and witnessed, held with song, touch, food, prayer, and community. Midwifery was often understood as a calling. And then regulations stepped in, not to improve outcomes, but to control who was considered legitimate. Licensing laws pushed granny midwives out. Traditional practices were labeled unsafe without any type of evidence. Generational knowledge was interrupted and criminalized. This loss wasn't accidental, but now we're watching a return. Doulas, community birth centers, home birth advocacy, and Medicaid fights for doula reimbursement aren't trends, but they're corrections. Research now confirms what granny midwives always knew, that trust, support, calm, and autonomy improve birth outcomes. Birth justice isn't just about preventing harm, but it's about restoring agency, ceremony, and joy to how life enters this world. Now, most people know Fannie Lou Hamer for voting rights, but her story is central to reproductive justice. She exposed the forced sterilization of Black women in what she called the Mississippi appendectomy. She herself was sterilized without consent, which wasn't rare. The state decided who was worthy of reproduction, and despite all of it, she sang. Singing was part of survival and strategy. It held people together in terrifying conditions. Joy and resistance live side by side. Her legacy reminds us that the right not to have children means nothing without the right to have them safely, willingly, with support. Today's fights against sterilization abuse in prisons, detention centers, and family policing systems are continuations of her work. Naming that harm isn't about staying stuck, but it's about refusing to let it repeat itself. The Black Panther Party understood something clearly. Healthcare is political. They didn't wait for permission, but instead they built free health clinics, offered STI testing, sickle cell screening, and health education. They treated care as dignity and not charity. And the state responded with surveillance, criminalization, and sabotage. Their work was visionary. They centered trust, self-determination, and community knowledge. Their sickle cell programs forced national attention onto a disease medicine had ignored. If the increase of visible mutual aid during COVID felt familiar, this is why. Those clinics weren't just about treatment. They were about proving communities can keep each other alive. Loretta Ross helped name what many movements avoided, that choice without access isn't real choice. She faced racism and marginalization within feminist spaces. Her politics are lived as she's also a survivor of sterilization abuse herself. Loretta built coalitions, language, and a framework rooted in dignity. Reproductive justice is about the right to have children, not have children, and to parent in safe and supported communities. That framework now shapes conversations across abortion, housing, disability, immigration, and healthcare, because bodies don't live single-issue lives. SisterSong didn't just name reproductive justice, they built the infrastructure for it. They organized across race, gender, and geography, and insisted that those most impacted lead. They built movement spaces that hold grief and celebration, music and meals, leadership as care. They model organizing that is sustaining and not just urgent, relationship-based and not reaction-based. And that matters for the long haul. Dr. Elders was the first Black U.S. Surgeon General and she told the truth about sex education, contraception, and pleasure, and unfortunately paid the price for it. She believed young people deserved honesty, not fear, that pleasure is part of health, and that sexuality is part of being a human. Today's attacks on sex education and book bans are modern versions of that same discomfort. Her legacy reminds us that pleasure is information, and information keeps people safe. Black women have always led HIV education and care, often without recognition. They built peer support networks, pleasure-centered education, and care that refuses shame. Their leadership drives U equals U advocacy and challenges criminalization laws. Because of their tireless work, we recognize that stigma-free, pleasure-aware care saves lives. Today's Black maternal health movement carries all of this forward. Organizations like Black Mamas Matter Alliance and Ancient Song Doula Services are fighting for birth that includes safety, autonomy, and joy. Policy fights around paid leave, Medicaid extensions, and provider accountability are acts of repair. The shift they demand is profound. It's from avoiding harm to centering joy. Honoring the Black women who created this movement means more than just saying the words. It means following Black leadership and moving resources. So if this episode is resonating with you, here's a few ways to continue the work in real ways. Number 1, follow and support Black-led reproductive justice organizations, not just on social media, but in practice. Learn from these organizations and lift up their messages. Take direction instead of reinventing. Don't water down the framework to make it more comfortable or mainstream. Reproductive justice is intentionally political, intersectional, and rooted in lived experience. Black-led organizations have already built strategies around abortion access, birth justice, trans healthcare, HIV justice, and disability justice. The work exists. Support it instead of duplicating it. Number 2, use your resources, not just your language. Posting statements without shifting money, access, or opportunity is simply just performance. Solidarity means redistribution, and that can look like donating consistently, not just during crisis moments, sharing your platform and audience, recommending Black leaders for paid opportunities, and redirecting funding, contracts, and speaking gigs when you have access. If your support never costs you anything, socially, financially, or professionally, it's not solidarity. Number 3, defend pleasure and autonomy in policy fights. It's easy to narrow the message to what sounds safe or reasonable, but reproductive justice was never about the most palatable demand. It's about full humanity, and that means defending comprehensive sex education, gender-affirming care, birth options including home birth and midwifery, the right to parent with support, and the right not to parent. Pleasure, autonomy, and dignity are not side topics, but they are central to health. When the messaging erases pleasure, it reinforces shame, and shame is nothing more than a control tactic. Number 4, do the work in your own community. If you are a white person like me, part of this work is challenging racism where you have access in your workplaces, family, faith spaces, schools, and even local politics. Black organizers should not have to carry both the trauma and the labor of educating everyone else. Use your proximity to power, interrupt harmful narratives, push for policy changes locally, and advocate for funding community care. Accountability starts at home, not just online. Number 5, practice gratitude as a political act. Say the names, teach the history accurately, credit the originators, and protect joy. Gratitude is political because erasure is political. Highlighting Black women's leadership stops the cycle of using their labor without credit. When we celebrate joy, pleasure, and brilliance, and not just survival, we refuse to let Black life be framed only through suffering. Gratitude keeps movements human. It reminds us this work is not just about fighting systems, it's about building a world where people get to live, love, parent, create, and experience joy with dignity. Reproductive justice is not a trend or a soundbite. It is a legacy built by Black women who refuse to accept crumbs. This Black History Month, we honor that legacy, not just by remembering, but by acting, protecting, and continuing the work. Reproductive justice was never just about what we're against. It's about what we are building. Be sure to check out the show notes for some amazing accounts to follow to continue your learning, growing, and uplifting. Until next week, bye!